So clinical audit. What is clinical audit? Clinical audit is a quality improvement process that measures current patient care and outcomes against agreed standards of best practice. A clinical audit is a systematic process designed to review and improve patient care and outcomes. It involves comparing current practice against established standards, identifying areas for improvement, implementing changes, and re-evaluating practice to ensure improvements are sustained. So we have to identify an audit topic, then we set the standards, then we design the methods, collect the data, analyze the data, and if changes are required, we implement the changes, and it is a perpetual cycle. It goes on. So the main steps in a clinical audit are identify the problem or issue, select a topic relevant to patient care, and identify the standards or guidelines to be audited. That is the main problem. That is the core of the whole clinical audit. Then set criteria and standards, establish the specific criteria and standards against which current practices will be measured. Then we are going to collect the data, gather data on current practices to see if they meet the set criteria and standards. Analyze the data is the fourth step. Compare the collected data against the standards to identify any gaps or areas for improvement. Implement the changes, develop and implement a plan to address the identified issues and improve practice. Then re-audit. Collect the data again after a period of time to assess whether the implemented changes have led to improvements and if standards are now being met or not, or any further steps would be required to come to these standards. What is the purpose of the clinical audit? The purpose of the clinical audits is to enhance patient care, ensure compliance with the best practice guidelines, and foster a culture for continuous quality improvement within healthcare settings. Benefits of the clinical audits. Improve patient care by identifying and rectifying deficiencies in practice. Clinical audits help improve the quality and safety of patient care. Enhanced professional practice. Audits provide feedback to healthcare professionals, help them understand how their practice compares to standards and where they can improve. Then the resource optimization. By ensuring practices are efficient and effective, audits can help in the better utilization of healthcare resources. Accountability and transparency. Clinical audits promote accountability and transparency in healthcare services, fostering trust among the patients and the stakeholders. Examples of clinical audits. Medication audits. Evaluating the prescribing, dispensing, and administration of medications to ensure adherence to the guidelines. So someone is not just to every single patient they are prescribing Percocet or like other analgesics which contain narcotics, and then people are coming and asking you to write the same medicine again and again. Probably they got addicted to it or whatever. So that is not correct, and we have to adhere to the proper guidelines. Infection control audits. Assess the implementation of infection control practices in healthcare settings. Your sterilization standards should be so immaculate that even after attending a patient of Hep B or Hep C, or maybe HIV positive or an AIDS patient, again, you would be able to sterilize your instruments properly, and you can see the next patient with the proper standards of your sterilization. They should be very immaculate. It is not that, okay, I will be seeing these type of patients with the infectious diseases towards the end of the day, blah, blah, blah. This kind of discrimination is not allowed. Patient record audits. Reviewing patient records to ensure completeness, accuracy, and compliance with documentation standards. Questions in our exam, they come in like on the ionizing radiation or ionization radiation. So clinical audit and ionizing radiation regulations. Clinical audits in the context of ionizing radiation are essential for ensuring that radiological practices adhere to safety standards, optimize patient care, and minimize exposure to radiation. These audits are guided by various national and international regulations and standards aimed at protecting both patients as well as the healthcare workers, because you are also and your staff is also at risk. Ionizing radiation regulations, ionizing radiation medical exposure regulations, then International Commission on Radiological Protection, and European Basic Safety Standards Directive, BSS Directive. So, ionizing radiation medical exposure regulations, the purpose is these regulations set out the responsibilities and duties for the safe use of ionizing radiation in medical settings. The key requirements are justification. Any exposure to ionizing radiation must be justified by the benefits outweighing the risks. And this is what we also call prescription radiology. It is not that any patient coming to you and uh, they were there like last week as well, and you are just taking x-rays after x-rays and after x-rays. No, it is not like that. Prescription radiology is important. Like you take those x-rays which are really important, which are required. Justification, optimization. Radiation doses should be kept as low as reasonably practical, which we call LR or LRA, consistent with the intended purposes. Dose limitation, defined dose limits should be not be exceeded, particularly for healthcare workers and the general public. And that is why in those clinics where lot of x-rays are being taken, the healthcare workers, they always carry that radiation tab with them, and after 1 year the tab is going to be analyzed at how much radiation in 1 year they have gone through. Quality assurance. Systems should be in place to ensure the consistent quality and safety of radiological procedures. International Commission on Radiological Protection. Guidelines. It provides recommendations for radiation protection, including principles of justification, optimization, and dose limitation. ICRP publications, they offer detailed guidance on managing and monitoring radiation doses in medical imaging and therapy. European Basic Safety Standards, BSS directives. Requirements establishes uniform safety standards for the protection against the dangers of ionizing radiation across European Union member states. Implementation. Member states must implement these standards in their national legislation, ensuring comprehensive protection measures. Clinical audits in ionizing radiation. What is the purpose? To assess compliance with regulatory requirements and best practice guidelines, to identify areas for improvement in the use of ionizing radiation in medical settings, to ensure the safety and effectiveness of radiological procedures. We are discussing clinical audits in ionizing radiation. So the process is selection of audit criteria based on regulatory standards, professional guidelines, and evidence-based practices. Then data collection, gathering information on current radiological practices, including patient dose, records, equipment, performance, and the procedural protocols. Then comes analysis, comparing collected data against the set criteria to identify any deviations, or maybe there are some areas of non-compliance in your clinic. Then implementation of changes, developing action plans to address identified issues such as updating protocols, enhancing training, or improving equipment maintenance. After some time, re-audit is going to be done. So conducting follow-up audits to ensure that implemented changes have led to improvements and sustained compliance. Examples of audited areas. Patient dose monitoring, ensuring that doses are recorded, reviewed, and kept within recommended limits. Equipment quality control, regular testing and maintenance of radiological equipment to ensure optimal performance and safety. Staff training and competency, ensuring that all these staff or the personnel who are involved in radiological procedures, they are adequately trained and aware of safety protocols, like they know how to take the correct x-rays. Maybe they are not fully trained and they won't be taking good x-rays, and then they would be repeating it and repeating and repeating it. So everybody, including your patient, they would be affected by the excessive radiation. Procedure protocols, reviewing and updating protocols to align with current best practices and technological advancements. Clinical audits in the dental radiology. Clinical audits in dental radiology, so they are crucial for ensuring that radiological procedures are performed safely and effectively, adhering to the highest standards of care. So these are the 5 radiological procedures in dentistry which should be subjected to the clinical audit. Intraoral radiography, panoramic radiography, cone beam computed tomography or CBCT, and cephalometric radiography, as well as the bite wing radiography. Firstly, the intraoral radiography, which we also call the periapical radiographs. Justification for audit: this is the most common radiographic procedure in dentistry used for detecting caries, assessing periodontal health, and evaluating endodontic treatments. Audit focus area: dose optimization, ensuring that the lowest possible dose is used while achieving diagnostic quality. Image quality: regular assessment of image clarity and detail. Exposure settings: reviewing and standardizing exposure settings across the different devices. Potential issues would be variability in exposure times, differences in film sensor positioning. Maybe the X-ray would be having a cone cutting, or would be having like not completely, or maybe the uh, tooth of interest is not even coming in the exposure area. So all these would be the problem. And inconsistencies in processing techniques. Then comes panoramic radiography. Justification for audit: used for comprehensive views of the jaws, teeth, and surrounding structures. It's vital for assessing developmental anomalies, impacted teeth, and fractures. Audit focus areas: patient positioning, correct positioning techniques to avoid any distortion, the patient's Frankfurt horizontal plane should be parallel to the floor, etc., so that there won't be any like uh, problems with the angulations, and then you have to repeat the X-ray. Then the radiation dose, monitoring and minimizing the radiation exposure, image quality, ensuring panoramic images meet diagnostic needs without artifacts or blurring. Potential issues would be misalignment leading to poor image quality, which I just told you, unnecessary repeat exposures due to any problem, and inconsistent patient instructions. Then comes CBCT. Justification for audit: provides 3D image for complex cases such as implant planning, assessment of pathological lesions, and detailed anatomical evaluations. Nowadays, in North America especially, even for the third molar surgery, which is complicated third molars, they advise you to go for the CBCT. And of course, CBCT is also being used for the assessment of fractured roots or something like that, which would be giving you trouble in assessing whether there is a fracture or there is some additional canal present or whatever. Audit focus areas. Indications for use: ensuring CBCT is used appropriately and justified for each case. Dose optimization, assessing and minimizing radiation dose while maintaining image quality. Training and competence, ensuring operators are adequately trained in using the CBCT technology. Potential issues would be overuse of CBCT for cases that do not require three-dimensional imaging, high radiation doses, and lack of proper training. Cephalometric radiography. Justification for audit is essential for orthodontic assessment and treatment planning, providing lateral views of the head, audit focus areas, standardized positioning, consistent patient positioning to obtain reproducible images, radiation protection, implementing the measures to protect patients from unnecessary exposure, image quality, evaluating the clarity and diagnostic value of images, potential issues, mispositioning leading to skewed results, and inconsistencies in the exposure parameters. Bite wing radiography. Justification for audit primarily used for detecting interproximal caries and assessing bone levels in periodontal disease. If the angulation is not correct, then contacts won't be properly visible and teeth, they will overlap each other. So if there are incipient caries, they won't be you won't be able to identify those or diagnose those because they won't be visible if the teeth are overlapping each other. Audit focus areas, frequency of use, ensuring bite wings are taken at appropriate intervals based on individual patient risk, radiation dose, optimizing settings to reduce the exposure, film sensor placement, consistent positioning to avoid retakes and ensure diagnostic accuracy, potential issues, overuse in low-risk patients. If it is not required, don't take it. Another question they can ask you, like a patient who is just 5 years old or 6 years old comes to your practice, all the contacts are open and patient does not have any poor oral hygiene, and they are in a habit of now cleaning their teeth twice a day, and patient is not taking any like drinks or the sugary snacks. What X-ray are you going to take? We are not going to take X-ray if the contacts are open for a young child. Poor technique leading to inadequate images and high retake rates. Benefits of this audit. Conducting clinical audits on these radiological procedures help ensure compliance with radiation protection guidelines, enhances diagnostic accuracy, and improves patient safety. Audits should focus on areas such as dose optimization, image quality, operator training, and justification for the use of radiographic procedures. Regular audits not only maintain high standards of care but also foster a culture of continuous improvement in the dental radiology practices. Body which is responsible to regulate and legislate the medical exposure to ionizing radiation in Ireland. In Ireland, the body responsible for regulating the legislating medical exposure to ionizing radiation is the Health Information and Quality Authority, or HIQA. It develops standards for quality and safety in health and social care services, including those involving medical exposure to ionizing radiation. Additionally, EPA in Ireland plays a significant role in regulating ionizing radiation. EPA's Office of Radiological Protection is responsible for the protection of people and the environment from the harmful effects of ionizing radiation. These bodies ensure compliance with relevant legislation such as the European Union's basic safety standards, directives, and oversee the implementation of safety standards and guidelines for the use of ionizing radiation in medical settings. So in conclusion, we can say that clinical audits are essential for maintaining and improving the quality of healthcare services, and they provide a structured approach to evaluating practice, identifying areas for improvement, and ensuring that changes lead to better patient outcomes. Clinical audits play a crucial role in ensuring the safe and effective use of ionizing radiation in medical settings. By systematically evaluating and improving radiological practices, these audits help to protect patients and healthcare workers from unnecessary radiation exposure while maintaining high standards of care. Compliance with regulations like IRMER and adherence to guidelines from bodies such as ICRP and European PSS directive are integral to these efforts. So over here, we are done with this lecture